Very important. The FDA is now warning women with breast implants that the scar tissue could develop unusual forms of cancer. Malignancies are rare, very rare, but they can occur in all types of breast implants, including saline, silicone, structured, textured. So we brought in a plastic surgeon to talk about this, Dr. Alexis Parcells. Good morning. Thanks for coming in.
Thanks so much for having me.
Well, it sounds scary.
It does sound scary, yes. So the FDA issued a letter late last week letting us all know, both patients as well as practitioners, that there is a new type of breast implant cancer that has just come out. Currently, we know it as squamous cell carcinoma, SCC, implant type cancer. There's currently 35 million women who have breast implants, and so we now know about 16 cases of this. So we're learning more. The research is evolving. We're going to get some new information hopefully in the next few months. But it is important that it is on everybody's radar.
So it's a small number when you say 16 out of millions and millions and millions. So what do we look for? First thing first, what would be like a telltale sign that something is amiss?
Yeah, it's a great question. I tell my patients every month, do a self-breast exam. I call it feel it on the first of every month. That's a great time to go and you want to feel your breasts for any masses, any skin changes, redness. We are seeing in some of these women that one side of the breast is swollen as compared to the other side. That's unilateral breast swelling. That could be fluid around the implant, the scar tissue, or the capsule. And oftentimes patients, if they complained that there's tightness around their breast implants, known as capsular contracture, that's also a sign that you may need to be worked up. So it's a good idea to go see your board certified plastic surgeon if you are experiencing any of those symptoms.
Another tip is take pictures. What are we looking for?
So I usually say patients, they are doing their monthly self-exams, but things can change very slowly. And so I often say to my patients, take an encrypted photograph, have an encrypted folder on your phone, and that way you can monitor changes throughout the course of the year just by looking at pictures.
So you brought in a number of different implants. Tell me the differences between them, because what's happening? Is something leaking out, or is it just at the incision that we're getting it, where we're having this reaction, which is like basically like a skin cancer that happens in the scar tissue?
So what's interesting is that back in 2018, there was a recall of this textured device, the 410 textured device. And that was for a lymphoma type of cancer. And when we're seeing this cancer, this is not a breast cancer. This is a cancer of the scar tissue or the capsule around the breast implant. As we've continued to study more of these capsules and have more sophisticated research, we're seeing that it's not only a lymphoma, but now we're seeing this squamous cell type. It's not along the incision, it's around that entire scar tissue that is holding that breast implant in place.
Wow.
Yeah.
That would, so if you, and I know many good friends and people that have breast implants, would you take them out?
It's a good question. In our practice, I say you had the right to have them in and you have the right to have them removed. So it's your body. Breast implant surgery is elective. A lot of women just feel like, you know what, this is where I am at in my life and I don't want to have implants in anymore. The FDA is not advising that women have these implants recalled or have these implants taken out at this point. You have to do what you feel is best for you, but I would say to continue monitoring information from the FDA and the American Society of Plastic Surgeons, because that's where you're going to get the best information as we continue to learn about this.
And as they are designed, they don't last forever. You change them out every 10 years, right?
So that's what the research initially was showing. Some of the more cohesive devices, I'm seeing patients who've had their implants in for 15, 20 years without issue. The monitoring, ways that we can monitor our implants with the self-exam and ultrasound in our mammographies, MRIs, there are ways that we can see changes in the implants, but you really are your own best advocate.
Does it show up in a mammogram, if we get a mammogram?
The new implant cancers, we're looking more into what exact diagnostic studies. Oftentimes, if there is some fluid around there, we can see that with imaging, and we're able to take the fluid out and send it for certain cell types, which is giving us a lot of good information.
Well, thank you for coming in, because it's something I know a lot of people would, obviously, they're going to want to pay attention. Talk with your doctor. You talk with your doctor. You're in charge of your health care.
Absolutely.
And what's right for you.
And make sure they're a board-certified plastic surgeon. Yes.
Like you are. Yes. Thank you. We really appreciate it. Thank you for coming in and bringing your props as well. We appreciate that.
Absolutely. Thanks for having me.